let me do it now. So here we go. Wonderful. Week 5. All right. This week we are discussing barriers, obstacles, and impediments to health improvement. More specifically, issues connected to psychological disorders and related issues and adverse childhood experiences are taken into account. While the job and scope of practice of a health and wellness coach practice motivation interviewing is not to diagnose and treat this disorder, it is very important to be aware of the challenges related to this clinical area. Meaning you will have to refer out if you're not licensed. Main goal. In this lab practice, the patient presents to the coach in an overall positive mood and affect and is interested in further discussing dietary recommendation as addressed in previous session they had with the coach. However, in the middle of this meeting, it becomes evident that the client has been triggered by something mentioned during the conversation. Note, these might be difficult to convey during this lab, as some of the suggestions might be difficult to discuss and rehearse. As example, some of these triggering words or topics could include a difficult work situation, for instance, a toxic boss or a toxic work environment, a problematic relationship, distant or abusive partner, a judgmental friend who might have consciously or subconsciously shamed the client on their perceived physical appearance, lifestyle choices, etc. Finally, a disappointing previous experience with a provider, therapist, case manager, nurse, etc. Finally, the role of the coach is to navigate these difficult emotions with the client, for instance, by working on emotion regulation skills, following the model presented in this module. Now, I'm not expecting you to know a lot about emotion regulation skills because we're just practicing now, but this is one of these areas taken from DBT. One of the techniques that DBT utilizes within emotion regulation is space and time. So, for instance, the old grandma recommendation, count till 10 before you say something if you're stressed, okay? So creating a space between your awareness, your perception, and your reaction, okay? Whatever is happening, give yourself the time to feel it in your body before you say something. This is just one technique. You don't even have to apply any of that. Nobody's expecting you to know anything about emotional regulation from DBT perspective. The idea is this. We practice a lot of skills. We refine some of them. What happened if things just fell apart seemingly randomly? Now, the reason I give you this example is because I want you to be empathetic, nurturing to yourself, and safe. So don't venture on anything that might be triggering to you either. Those are just examples, of course, okay? It might be triggered by, the client might be triggered by, I don't know, the color of your shirt. You can just pick anything. The idea is this: the client should change their emotional presentation randomly, just suddenly, okay? And it will change. No, I'm not expecting you to rehearse something that's too intense, like yelling or anything, but definitely something that the coach will recognize as something happened there. Question before we switch to the breakout rooms.
Dr. Tomasi?
Yeah.
I have a specific question to something similar that happened in one of mine. And I was just wondering if after class, if I
Sure.
could talk to you about it. Okay, thank you.
So let's do this. We will try to come back around 6-ish, because we kind of started late. We couldn't, how about this? Let's just do 6:05. And then if there are further questions, I'll be happy to stay longer on Zoom and address those questions afterwards. All right. Great. Kelly, how are we doing? Oh, I realized I just wrote theosis only to you, Kelly. My apologies. Well, going back to Eastern Orthodoxy, Catholicism, Buddhism, that's what the term that I was mentioning earlier. Here you go, theosis.
We are all set with the rooms.
Thank you. Thank you. Thank you. Thank you.
You want me
All
to
right.
put them now?
Yes, please.
Bye, everyone.
All right.
So then based on your list you sent me, you would go to room 3 and I will go to room 2.
Fantastic. Thank you again. I appreciate it.
You're welcome.
All right.
Add the triad coaching thing too.
Hi, Dr. Tomasi.
Hi, Dr. Tomasi.
Hello.
So we have the situation. Who would like to coach first?
I can try coaching.
Okay, and Lisa, do you want to be client or observer?
Yeah, I'll be client.
Okay, I'll go dark, and let's see, it's 5:32, so why don't we give it till 5:37?
Yep.
Okay.
All right.
Hi, Lisa.
You're muted, Dr. T.
Yeah, we can't hear you.
How about now? I always forget to do that. Great. Simply said anything that went well, did not go so well, thoughts? Yeah,
It
yes,
was,
Mika.
it was definitely, it was challenging, I would say, like for all of us, it was different than the previous sessions, but a couple of questions came up to us. So one is when the client is so emotionally charged, are they fully present in the session and are they hearing what you're trying to say? And the reflections, like when I was the client, I felt
Yeah.
like I missed something that the coach said and the observer
Huh.
brought it up.
Okay. So is the question how to make sure that they, so to speak, pay attention?
Right.
Yeah. So, well, repetition is fine, especially if you feel that the person's facial expression doesn't change. So you wonder, did you get this or not? I mean, it's a gray area because you cannot assume that everything you say, it's like, worthy of a Pulitzer Prize, it might be just common sense or the person might just heard it 1,000 times. So it might not be that insightful, but you can ask, does that make sense to you? What I just said, what did you say? And so you can just repeat that. And if things are missed, well, at some point you might be able, because this is again, it's a 5-minute interaction, but if the conversation is longer, as long as you keep it longer, then you might be able to detect whether there's a missing piece. You might want to prioritize things. So this is an advice I have for all of you. You might never have the chance to work with a person who is going to present in so much distress ever, but maybe just have a, to-do list somewhere so they can say, well, if there's any situation of threat or danger, this is the last thing I want to try to conclude my session with. It might be just a phone number. It might be a suggestion of, well, perhaps we need to call 911. Okay. Now, let me elaborate on that super quickly. As a health coach, as well as a psychologist, really, you cannot force anybody to call 911, even if they are threatening to harm themselves in front of you. If you feel that the situation is escalating to the point that they're actually going to do that, then you pick up the phone and call 911. Same thing if you feel threatened. Even if you exaggerate the magnitude of what you're observing, if you are feeling that way, you're always justified in calling 911. Of course, 911, it's not necessarily, the call doesn't guarantee the fact that a psychologist will come to you right away. The police might show up first, but at that point, in terms of the cost-benefit analysis, better than nothing else. And of course, that will create some sort of tension with the client. If the client thinks, well, you just overreacted, well, better, venture on the safer side. I'd rather be labeled as overreactive rather than not reacting at all. One thing. The other thing, also super quick, nobody's expecting you, and I mentioned this in the breakout room too, nobody's expecting you to be emotionally a cyborg or an android. So you have your own emotions. And if you ever feel that the conversation is going to a place where you don't have either the skills, the patience, the empathy, whatever it is, feel free to say it. Nobody's expecting you to fix the problems of the world. You just want to work as much as you can on the way you're going to convey that. So I have a few more things, but I want to give enough time to everybody to give me feedback.
Thank you.
Sure. Libby, you have your hand raised?
Yeah, I'm wondering, would a welfare check be the same as calling 911? Is it considered the same thing in terms of you've got to feel threatened or yourself?
Yeah,
Like,
that's a great area. Yes. Yeah, I'm not sure how to answer this question because it's such a murky area of ethics. So I'm gonna say as bluntly as well as honestly as I can. We had to set the record straight here. If someone were to harm themselves, at some point you will have to bring yourself to the awareness that you might not have been able to do anything anyway. In a sense that the sense of inner responsibility mixed with guilt consumes you. But you also want to make sure that you at least mention it. Which way you want to take it? That is the hardest question to answer. In my field, it would always be, well, in my field, there are two levels. One is the ER and second is 911. So that will be equivalent for my profession.
so a welfare check, though, is often the police coming to check on a person. So it's not 911, there's an emergency right now, but it's calling the police and asking for a welfare check. Correct?
It is, but
So it is, I think, two different things, but I don't know if they are the same in terms of the law, but maybe, I don't know.
well, the thing is that this is, I mean, I'm not a lawyer, so I don't know the repercussion in terms of the follow-up thing, what the difference is. In my training, you don't even have to specify, in a sense that one scenario might be that, I don't know, I'm going to really create a scenario that's really extreme. The client is in so much stress that will keep you prisoner, not because they really want to harm you, they don't have the intention to do that, but they don't know where else to go and they kind of lock themselves in. And so you can call 911 just for safety in general. Whatever you're going to say, it's going to be ethically and legally justified, as long as someone shows up at your door. Now, it is true that the difference is about who's going to show up at your door. A police officer is not a trained mental health professional, or sometimes it is, but you can make this assumption. But again, it goes back to what we said earlier about DBT. Anything that can break the chain of cognitive events, that can give you some space and time, it's good. And again, I'm not suggesting that it would be pleasant. It would be very stressful, the whole interaction. You know, if someone's already in a lot of stress, seeing police officers sometimes doesn't add more positivity, as more stress. Mm-hmm. But both provider and client have been cornered at this point. There's no other option. So what I'm trying to say is, do not feel bad if that is what happens. Mm-hmm. You might never have to go on that route, because let me again being very clear here. Where do you draw the line? I mean, in my field, I hear more times than not, I feel my life is not worthy. I want to end it all. It's almost like, you know, bread and butter, unfortunately. How literally are you going to take that statement? That's where those soft skills come in. I would say that overall, it's a good thing to consider that a client is prone to share that with you, which means that you have leverage during a conversation. if nothing else, have the leverage to continue the conversation until someone else arrives. Now, okay, so let me add what I shared earlier with you, Libby, and then in the context of the small group, the breakout room. So what I shared earlier is that nobody's also expecting you to be the strongest, most balanced person on earth. You might have some emotional baggage yourself. In the absence of any threat, you simply say, this is too much for me. I'm not going to do this. And that's it. And the example I mentioned in the breakout room is unfortunately, the population I work with very often, unfortunately, very often, is a population that includes sex offenders. There's a lot of pedophilia and a lot of incest. And what I'm saying is that what's worse than that, and being violated, abused by your own family, right? And so I'm a human being as well. I'm a father, so I cannot make the claim that those things do not affect me on a personal level. And in the breakout room, I said, if I can ever imagine anything of that sort happening to my children, I'm not going to be able to sit down and practice motivation interviewing. I will be very emotional, okay? But I know two things. The first one is that in the context of a clinical intervention, I always have the moral right to say, if this is too much, it's just too much. It doesn't say anything about the quality of my treatment or the quality of me as a person, in which case this is enough to refer out. So say, well, I'm sorry, I cannot be more helpful, but I really think that this will, warrant further referral. Even if they disagree, it's your right to do that. Second thing that I also mentioned in the breakout room, which you, Lisa and Sarah, if you feel that you can still navigate this complexity and you're still okay, at least having a conversation with that person, it's always a good thing, because even the most horrible situation with a person in front of you, you judge them as a horrible person. What's worse than this type of abuse? Well, the fact that you're doing something with this person helps break the chain. So even if you don't care anything about the person specifically, you still judge the behavior as immoral, pure evil. The fact that you're having this conversation will reduce the likelihood that this will be perpetrated to the next victim. And so you don't have to agree with anything. You don't have to appreciate anything specifically about this person, but you nevertheless have an opportunity to change things here. All of this, and I finish, keeping in mind that you don't have to diagnose or treat anybody. We're just talking about creating a safe space. So that was a lot.
Thank you.
Sure. Anything else on a brighter side after this heavy load of ethics and struggle?
I'll share a little bit about
Sure.
my group. I think, we were all sort of equally as anxious about being the client as opposed, in addition to the coach, given we weren't exactly sure what the demeanor or what was going to happen to change things. But some interesting things happened with all of us, in that we were able to even, one of the coaches develop an action step for the crisis at hand in less than 5 minutes. And that, okay, so this happened to you, so how, let's talk about it. And how can, until you're in a situation, cooking with this person, for example, what are you going to do before that happens again? Are you going to, talking about communicating, whatever. And the client was able to come up with, an action step by the coach sort of helping, listening and helping her think about what has worked in the past. So it was, I thought that was really good in a short span, that
Wonderful.
to get, for the coach to get the client on track for that. There was a lot of empathy and a lot of sort of, rephrasing, summarizing, and affirmation. And, I think given I felt like, we were able to navigate the mood change better than we had thought we would. So
Good job.
Yeah.
That is great. Good job. Good job. I mean, not being present. Well, first of all, just having action steps planned Yeah, 100 points just for having that. And the other thing I want to mention is this: in a question of crisis, one of the very common things that happen to us is a narrow tunnel vision emotional response. I understand some of you also need to leave, so I'll continue. Feel free to stay here as long as you can, or log out of here. So you have a tunnel vision that really makes you think that there is no past or future. So the fact that you emphasize the fact that what did help in the past is actually a good thing, because there is something outside this very moment of crisis. It's a really good idea to say, okay, well, sure, this is it. This is one of the worst situations you can ever be, but it's not the totality of your experience. Things were different in the past and could be different in the future. You'd have just no evidence that they have to be just like now. So working on that is spot on. Anything else? Well, thank you. Maybe just the last thing I want to mention is this was tough. All right. So first of all, because we already started with this, somewhat confusing discussion on parameters and scope of practice, and hats on, hats off, the expert, and asking for permission. So we started this with, okay, now I'm even more confused about what a health coach does, first thing. And then one thing is to refer out for a physical therapist, but referring out to a mental health professional is very stigmatizing, whether we like to accept that or not. So it requires a lot of emotional balance. So I just want to praise you for your ability to actually practice it tonight. It was one of the most complicated things to do. So you made it. Well, thank you. I appreciate your company, your enthusiasm, and I will see you, as we transition slowly to the second part of this course. All right. Wonderful. Well, you all have a good night. Thank you.
Dr. Tomasi.
Thank
Bye.
you.
Thank you very much.